My name is Morgan Lee Egnot. My pronouns are they, them. I am an MD PhD trainee at the University of Pittsburgh, and my PhD is in bioengineering. Bioengineering is so many different things. So if I would describe myself to another bioengineer, I'd say, hi, I'm Morgan, all of my pronouns, what have you. I'm a tissue engineer working in obstetrics and gynecology, and my research is focusing on making biomimetic surgical constructs for repair of pelvic organ prolapse and for vaginoplasty. But what that actually means is I take the natural composition of the vagina, study it, and figure out how we can mimic that in a surgical material that surgeons can use for vaginal reconstruction. And so this can frequently be used, or potentially be used, for healing injuries after childbirth, for vaginoplasty, for reconstructing a vaginal canal for someone who's transgender, things like that. So I've always wanted to be an engineer. That actually isn't true. I wanted to do art school until I was 13, but then after that, I decided that I wanted to be an engineer. I've always been really interested in figuring out what we can do to make surgery better. And among all of this, I began to think like, hey, we could be doing a lot better for our patients. And I have a 14-year-old's idea of what all of this is, so I was still very much thinking, wow, we could grow organs in a dish and transplant them into people. And when I started my undergrad, which is in material science and nanotechnology, I read a lot about regenerative medicine and biomaterials. So figuring out what are the different parts that make our organs work, and how can we learn from that and engineer something like that in the lab, so that when we are trying to eventually grow someone's organs in a dish, or to just make reconstructive surgery better, we have the knowledge we need to do that. So currently, when we do gender-affirming surgery, we are taking parts of a person's body and putting them somewhere else in a way that very much behaves like an organ. But when it comes to vaginoplasty or phalloplasty or any other genital gender-affirming surgery, which is what I'm academically interested in, we're never able to fully replicate that form and function. It's very hard to do that for any kind of organ system, for any kind of bioengineering research. And it's really hard in gynecologic research because of the lack of funding and the lack of awareness of these kinds of diseases that are affecting these surgeries that people do. I'm in the process of wrapping up a lot of different projects, so making sure all of my data is where it's supposed to be, writing my dissertation. I do all of that, and I also just think about my place in the world. Having been talking with other people in my field and other people working in biomedical research in general, this is a really strange and scary time for a lot of people. I really feel like I can make a difference carrying on the kind of research that I do in a different stage of my career. And again, it's what I've always been interested in. I really want to serve other trans people as a trans person myself. And I found that some of the most fun, best moments in my research and in my little bit of clinical career that I've had so far are when I can talk to real people about, what's on their mind, what are they looking for, how's their health. I think the only other thing that I want to say is a lot of people that I've talked with, that I'm close with, are scared and frightened, obviously. And I think that we owe it to the trans people in the future, many decades and generations from now, to keep going. I don't think we can give up. I don't think we can resign ourselves to despair or obey in advance or give up. I think if I can do that with a hope and a dream that I will make things better for someone like me in the future, it's worth it. I'm gonna keep doing it, no matter what. That is a promise and a threat.